Okay, this is Commander Arthur Blaine, and uh, I'm with OHSU San Diego and cross-assigned to EMF Pendleton. I am a family physician, um, and this is a lecture about stress management that I have been giving for several years. I came over to the Navy from the Air Force, and we had a very large number of unusually large number of suicides over a short period of time, and that was the genesis of this lecture. Um, Everybody has their own way of dealing with stress. My personal way of dealing with stress is running and swimming, and to a lesser extent, triathlons. Um, I firmly believe in endorphins. Other people have different ways of dealing with stress, and anything that works is wonderful. Is a great way to deal with it. It's when we don't deal with it that it becomes a negative influence on our life. So I'm going to go ahead and get started. So the objectives of this lecture, there's more than three, but I'm going to describe the three big ones. Describe the physiology and common symptoms of stress. Understand the definition, drivers, and interventions for provider burnout, um, and be able to discuss the treatment of stress and how to perform stress stoppers. So, the one of my previous jobs, I was a chief medical officer of a very small community clinic, and one of the people that worked there to get publicity and help us out had a good relationship with the San Diego Union Tribune. So I got to write a few articles in conjunction with their writers, and this is one of them. So April 7th, 2015, and um, the I was kind of a little bit taken aback that my name was not listed as the author, but because I kind of gave her the entire article. But anyway, it was fun to help out and feel like I've contributed a little bit to helping people out with this important topic. So, overview. Stress is the physiological and physical reaction to the demands of life. Stress is normal. If you don't, I would argue anybody who does not have stress either is not telling the truth or is extremely abnormal. Stress is good. Stress helps you deal with life and your job, uh, and in most circumstances, it should be have positive results. This lecture kind of tries to help with the potential negative experiences, negative results of stress. Everyone experiences stress to some degree. Common reasons why people experience stress include stress related to our job, our relationships, our family, finances, and healthcare issues. 40% of U.S. workers admit to office stress. 25% say work is the biggest stressor in their lives. The most important thing with dealing with this in a positive manner is simply acknowledging stress. It's always the first step in solving the problem. So, know thyself, or people say, look in the mirror. Healthcare workers are some of the worst people in the world to actually realize that they have stress, because we're constantly trying to help other people with their diseases and their stress that sometimes we forget to take care of ourselves. I'm not an incredibly religious person, but the most important phrase in the Bible that I always remember is, paraphrased, you have to take care of yourself before you take care of other people. I try to always remember that. So, provider burnout. This lecture, I've been doing this lecture for several years, and I just added the provider burnout slides, or I didn't label it physician burnout because uh, some of the most important providers in my practices are the nurses, the LVNs, the medical assistants, the lab techs, the physician assistants, nurse practitioners. We all are providers, and we all have an equal part in doing some aspect of healthcare. The most efficient and well-run practices I've ever seen in my entire life are practices where it's not just the provider, or physician or PA or nurse practitioner doing their job in a silo, which I've seen in some practices, which does not work. It's a team effort, a multidisciplinary team effort where the medical assistant, the LVN, the RN, all the leaders, administrators, everybody works together to achieve a common goal in achieving quality and patient wellness and worker and provider wellness. Primary care providers suffer from significantly higher rates of burnout than other specialties. Burnout can negatively impact the quality of care and result in providers leaving practice, and this obviously contributes to primary care workforce shortages. The, a couple definitions of provider burnout. So, a syndrome characterized by a loss of enthusiasm for work, emotional exhaustion, feeling cynicism or depersonalization, and a low sense of personal accomplishment. And another definition would be an emotional condition marked by tiredness, loss of interest, or frustration that interferes with job performance. Burnout is usually regarded as the result of prolonged stress. So, this entire lecture, you can probably photocopy and put into almost any profession. Uh, Engineers, lawyers, you name it. Every profession can, to a certain degree, relate to commonalities that healthcare workers deal with. Uh, Provider burnout. So common drivers of provider specific burnout. Paperwork. And when I say paperwork, you can insert the word electronic medical record in there. Doesn't matter whether you're writing on a piece of paper or pecking on a keyboard all day long. It's the same thing, right? Paperwork. Feeling undervalued. This is very important. We have to feel valued in what we do. Your boss has to appreciate you. Your coworkers have to appreciate you, and your family, your significant other, and family has to appreciate you. Um, we spend more time at work than we do at home. So that's central to this topic that we're discussing today. Other common drivers: frustrations with referral networks. I've worked in some practices where it is extremely difficult for me to get a consult from various specialties that I need. I have a cancer patient. I need an oncologist. It takes me several days or weeks to get that referral, and then I have to deal with the insurance company or utilization management to discuss why I need the referral. And so these are frustrations of providers. Difficult patients. There's very specific difficult patients. My personal difficult patients are those with opioid dependence, and the it's very challenging. The Other providers might have trouble with, for example, psychiatric or mental health patients if you don't have good support from a mental health team. There's various differences in providers about which kind of patients we have trouble with. Some providers have trouble when somebody comes in with, 10 or 15 different active medical issues, and we more or less have to manage all of them within a 20 or 30-minute visit. Medical legal issues are important in certain settings. Some practices are protected more than others. some that's another topic which I'll develop another lecture. It's an area of interest to me, and we can talk about that at a future date. Work-life balance challenges. That is the number one reason why nurses, doctors, and all healthcare workers retire early or quit or do something else is work-life balance. You have to have time for your family. You have to have time to exercise. You have to have time to go on vacations. These are all, that is probably the number one reason for stress and provider burnout. Interventions specific for providers, counseling services are shown to help self-awareness and mindfulness, and the system level interventions, so institutional success metrics. So in other words, we often put down, for example, blood pressure less than 140/90, or hemoglobin A1C is less than 8 as a metric, as a success metric for your organization. Is as administrators or leaders in the healthcare settings that we're in, put down one of those metrics as provider satisfaction and well-being, and keep in mind that one of the most important things that all healthcare workers equate to job satisfaction as being practice models that preserve decision-making autonomy. It's called the heuristic method of practicing, where you actually feel like you have input. I've been in organizations, very large organizations, where I had a wonderful idea for improving a certain small area of my practice, and you walk down the hall and talk to your boss, and your boss says, he does it in a nice way, but he more or less says, go back to work. You're not going to change that at this organization. And what he really means is the organization is way too big, it's institutional, and we don't have any input into improving that aspect of this organization. That's frustrating for providers and healthcare workers, especially when you have a great idea that might be able to help. I just want to this lecture is not about Navy specific stress control, but I want to mention it because it's important. There's actually a very, very good training program on it that is Navy specific. It's exactly the same as we do, say, for information awareness. These training programs that we do, the Navy has an operational stress control training module that is important, especially if you're a leader. So this Navy Operational Stress Control, or OSC, is part of the Navy's Suicide Prevention Branch, and it promotes an understanding of stress, awareness of support resources, and provides practical stress navigation tools to help build resilience of sailors, families, and commands. And I'm going to mention this 2 or 3 times in this lecture. For the Navy, and actually the entire military, help is always available by calling the military crisis line, and it's 1-800-273-TALK, option 1. You can text 838-255, or you can visit www.militarycrisisline.net for free 24/7 confidential help with this important topic. And I just want to briefly mention something interesting and I think extremely helpful no matter what level of leadership that you're in. And I just want to point out that if you're in the military, it doesn't matter what rank you are a leader. Even at the most junior rank up to the highest rank, everybody's a leader, and you have influence over your people around you. So I'm going to mention these topics. It's Admiral G. Ruffhead's specific instructions for Navy leaders, and I think it's very helpful for anybody. So the first one he mentions is train tough, but know your crew's limits. Training should strengthen and build resilience. Know your sailors. Every leader in your command must know their sailors well enough to detect any changes in behaviors that may indicate negative effects of stress. And one thing I'm going to insert in there that we used to talk about in the Air Force, and I mention everywhere, is if you see something, do something. So you go to work, and one of your coworkers, somebody, they don't say anything, but you can tell they're stressed. You can tell they're having a rough day or something's going on. Talk to them. Just be a buddy. Be their colleague. Be somebody who cares. So, if you see something, do something. Don't just ignore it. Don't go to lunch and go about your day. Talk to somebody. Just check in with everybody and just make sure everybody's doing okay that day. Address issues early to prevent bigger problems later. We know and apply this preventive maintenance principle with our equipment. Let's apply it to our sailors. So intervening early, having that discussion very early on instead of letting it, sit and cause problems for a long period of time. The longer it lasts, the bigger the problem is going to be. Foster a climate where asking for help is a sign of strength and commitment to the team. Much like a world-class athlete uses skills of trainers, coaches, and even sports psychologists, our world-class sailors need to know what skills of the chain of command, chaplains, and counselors to stay and get back in the fight to show strength and not weakness. So in other words, if you know that you're in a situation where it might help to talk to somebody, go talk to somebody. It's not going to get passed up the chain of command. Catch these things early and help yourself. Conduct after-action briefs where both leaders and sailors contribute to the discussion. This builds resilience and fosters unit cohesion. So, anyway, so to go on to the next topic, examples of work stress. Too heavy of a workload, too much responsibility, long working hours, poor management, unclear expectations, no say in the decision making process. We've touched on a few of these things before, but at when I at early in my career, the thing that used to drive me absolutely nuts is not knowing exactly what I was expected to do. It's you get a job and you're just kind of expected by osmosis to know what to do. It helps having a good leader and a good mentorship program where somebody says, here's what you do in this particular job, and if you have any questions, call me. Let me help you. Dangerous working conditions. Some more examples of work stress. No advancement, no future education opportunities, discrimination or harassment, sexual, religion, or race. That last one is a very important topic these days. Obviously, if you read the newspapers, and the Navy and most employers are taking a very serious look at that and trying to do proactive interventions to help with that. Examples of life stress: divorce, job loss, foreclosure, death of a loved one, moving, healthcare problems, serving as a caregiver for an ill family member. In the military, we can all sympathize with the stress of moving. Some people like it. During the 10 years that surrounded my active duty time, I think I moved 7 times in the Air Force. And so it's nice to have uh, as, as few of moves as possible. I think doing different things in the military and going and seeing different places in the Navy is is an awful lot of fun, but there has to be a balance also. Trauma, assault, car accident, robbery, natural disasters. There's an awful lot of these natural disasters going on. And the the one thing in my life that's going on right now, which it's actually not bothering me that much, is we had a water leak destroy about 2/3 of our house, and so we did the hotel for 2 months and a rental house for 3 months, and so it's not bothering me too much, but that's a stressor. Positive stressors. So moving. Some people like moving. Marriage, it could be a positive or a negative stressor. It depends on how you approach it. Returning to work from a long vacation. Uh, I think I think that should maybe go on the negative stressor. I don't know. For myself, if you give me 2 weeks off sitting on the beach somewhere, that first day back at work is rough. New jobs, that's always been a positive stressor for me. I'm very excited for the first month or two I'm on a new job, and then as the job responsibilities pile up, it kind of wears off, and then you just have to do a good job at your new job. New babies, for most of us, that's a positive stressor. That could be a negative stressor too, and almost every single thing I mentioned has positive and negative aspects to it. So they don't just fall into one category. Internal stressors are ways that we all deal with stress. So this gets into the physiology of stress, which I'll talk about next. Um, this can lead to extremely unproductive, unhealthy, and sometimes dangerous ways of dealing with stress. The way we deal with stress is influenced by our culture, our environment, and our genetics. In, this includes attitudes and perceptions, fear and uncertainty, and unrealistic expectations we often place upon ourselves. That can be, if you have children, I have 4 boys, and my 18 and 20-year-old are in college, and I try not to put any unrealistic expectations on them. I find, especially with my 20-year-old, and I find the less I do to pressure him to do well in school or get a good job or career or anything else that might be my expectations, the more successful he is. So I just try to give a lot of support and love, and I give him little hints about certain things, but I try not to do a whole lot of pressure on him. So teachers, employers, boyfriends, girlfriends, spouses, parents, all these people can put unrealistic expectations on us, and those are stressors. Personality and genetic constitution is extremely important in the way we deal with stress. I can see that in my 4 boys. I have 2 boys who deal with stress extremely well, and I have 2 that do not deal with stress very good at all. And it's just how you're made up genetically. It's how you were brought up. It has a lot of influences into what helps you deal with stress. Physiology of stress. So this is the fight or flight versus the rest and digest. This is the stuff we study in basic biology classes. So stress activates our body's nervous, endocrine, and immune systems. Another way to put that in a simple way is stress affects everything. Fight or flight. So this is, I think back to the days where, I don't know, thousands of years ago, millions of years ago, where we were hunting, hunters and gatherers. Some big animal starts chasing you, that's fight or flight. Your sympathetic nervous system kicks in, it releases neurochemicals, and you either get your weapon out and fight, or you run like heck, or climb up the nearest tree, or do whatever you can do to survive. And then the opposite nervous system is the rest and digest, or feed and breed parasympathetic nervous system. So that balances. There has to be a balance between the sympathetic and parasympathetic nervous system, or homeostasis between those two nervous systems. Stress lowers your immune system. Any of us who can think back in our lives on where we had a great deal of stress, and all of a sudden we're catching a cold or a virus or a fever or a stomach flu or something, and we're wondering why we caught it. I know for a fact that if things are going pretty good in my life, I catch a virus, and 2 or 3 days I'm feeling okay. And if I'm losing sleep and things are just really stressed in my life, that virus will last 1, 2, 3 weeks, a month sometimes, and just drive me nuts. And I can't get rid of it because my immune system is probably not as strong as it should be. And this leads to susceptibility to disease and infection. And I'll mention some diseases that are related to stress in a little bit here. Symptoms of stress. So, some obvious symptoms of stress: elevated heart rate, elevated blood pressure, elevated respiratory rate, anxiety, panic attacks, feeling of doom, bruxism, which is clenching your jaws, TMJ, temporomandibular joint disorder. The one thing I see in my practice, I think I get about 10 of these a year, is people come in and they feel like something is stuck in their throat. It's called a globus sensation. And it could be acid reflux, it could be allergies. It's almost always stress or anxiety. But any good doctor, we rule out the diseases first, and then it could be it boils down to stress or anxiety sometimes. Subtle symptoms of stress, which people forget about: anger, crying, insomnia, emotional lability. Your emotions just go up and down for no reason, apparently. Depression, lack of mental clarity. I've had people who are very young in their 20s and 30s who are just obviously stressed and have a great deal of anxiety come in and ask me to do an evaluation on their memory. They say that they can't remember things. They can't remember things in school or where they drove or different things at work. And sometimes it's just anxiety stress, which needs to be treated and diagnosed properly. Inability to concentrate, low energy, decreased libido. So other symptoms or diseases that are associated with stress, there's a great deal of them. Distracted driver, chronic fatigue syndrome, erectile dysfunction, headaches, diarrhea, irritable bowel syndrome, fibromyalgia, eating disorders. And in the eating disorders, I put obesity and things related to obesity include hypertension, diabetes, sleep apnea, and osteoarthritis. Alopecia, that's losing hair. I keep remembering that the nicest guy in the world, a classmate of mine in medical school, and I'm still not sure it was stress. I didn't talk to his doctor, and I didn't hit him up with too many details, but he, at some point during the middle of the year, he lost all of his hair. He lost his eyebrows, he lost his hair on his head, and uh, just informally talking to him, it seemed that it was due to stress. Um, Menstrual disorders in women, constipation, chest pain, dysphagia, so trouble swallowing. I, excuse me, I had the luxury of having that one during my fourth year of medical school, where I was extremely stressed trying to pass a uh, microbiology class, and I was having all kinds of trouble swallowing and upset stomach. For me personally, when I get incredibly stressed, it hits my bowels, my stomach, and I have a lot of trouble with that. Vomiting. There's a syndrome that I've only seen two or three times in my 25-year career. Cyclical vomiting syndrome. I've seen it a few times, and there's not a whole lot to do other than you can try to get somebody help with mental health. You give them the medications for vomiting, and there's not a whole lot else to do. Other than try to solve it through those means. Drug, tobacco, and alcohol abuse. That's a very complicated topic, obviously, but sometimes it's associated with stress, depression, anxiety, those types of things. Nervous behaviors. So, pacing, nail biting. I keep mentioning my own little problems, but so nail biting is something that I do if I get trouble with stress. Tapping a pencil. We've all been around that guy who can't stop tapping his pencil in college or somewhere. So, diseases that are made worse by stress: asthma, irritable bowel syndrome, depression, anxiety, PTSD, psoriasis. Uh, my, my spouse has psoriasis, and she will absolutely tell you it gets worse with stress. Eczema, which is dry skin, rheumatoid arthritis, tinnitus, ringing in the ears, bruxism. The Sometimes I think the statistic is 50% of the time bruxism is associated with anxiety, stress, PTSD. 50% of the time we don't know what it's caused by. Menopausal symptoms: childbirth, epilepsy, seizures, Crohn's disease, ulcerative colitis, acid reflux or gastroesophageal reflux. So, treatment of stress. First, know your mind and body and recognize and acknowledge your own stress symptoms. There's what I always tell people in my practice is there's three things you need to do to grow old healthy. And all three of these things involve activity. And somebody described it to me. In fact, I think I was in a lecture and somebody described it to me as a three-legged stool. If one of those legs is missing, the stool falls over. So it's analogous to your life. So these three things include exercise, which releases endorphins. Um, Endorphins are chemicals that are produced in your pituitary gland in tiny amounts, and they're 20 times more powerful than morphine. That's the runner's high that people get sometimes. I have most of my friends don't run, and they haven't the faintest idea what a runner's high is, and they don't want to find out because they don't like running. But it does exist. Um, so these three aspects to grow old healthy: exercise your body, 30 to 40 minutes of exercise most days out of the week. I tell people it does not matter what you do. The correct exercise is what you enjoy. So walking, swimming, biking, anything that gets your heart rate up or gets you sweating a little bit. They've done studies showing that comparing the marathon runner or the long distance runner who runs two or three times a week 20 miles versus the guy who walks 30 minutes 7 days a week, the guy who walks 30 minutes a day 7 days a week is in way better shape than the guy who does an extreme amount of exercise only two or three times a week. The second thing is exercise your mind. So reading, crosswords. I always remember my grandmother, who I was born and raised with since I was 1 year old, and she passed away of heart disease or aortic stenosis eventually. But to the day she died, she was sharp as a tack. She read the entire Los Angeles Times front to back every single day her entire life, and she was extremely uh, intelligent and sharp, even when her body gave out. The third thing is social. So exercise socially. So be among people at some point. Clubs, volunteers, be a docent at a museum. I probably plan on working in the next 20 years, 20 or 30 years. Being around your coworkers counts if you, especially if you have good relationships with your coworkers. The Being a your family is very important. So go to all those family outings and call people and go visit. One thing that I plan to do when I quote unquote retire is be a docent at a museum, and I think that would be enjoyable for me to help out like that. But anything counts. So treatment of stress. Treatment of stress needs to be multidisciplinary. So you need to pursue this in a multimodal manner for yourself and for your patients. So exercise, that's my personal way of dealing with stress, but that's very important. Sleep, get enough sleep. 8 hours of sleep a night. And they say for children it should be like up 9 or 10 hours of sleep a night. A balanced diet. So I have a colleague of mine who has a website and a book, and he's not alone. There are an awful lot of studies showing that carbohydrates are evil. There's a great book by a cardiologist called The Wheat Belly. And I'm not going to get into carbohydrates too much in this lecture, but eat a balanced diet: fruit, vegetables, fiber, and try to stay away from carbohydrates. I'll probably have another lecture later on carbohydrates because there's an awful lot of evidence on that one. Yoga is just an example. And by the way, nobody has to do all this, or you'd have to choose whatever works for you. That's the key. Whatever you enjoy and whatever works for you. Tai Chi. I was I had an uninformed attitude about Tai Chi prior to being stationed in South Korea for a year in the very, very beginning of my military career. And I did a little bit and watched an awful lot, and my spouse used to do it every day. It is difficult. Don't get fooled watching those slow movements. Medication. Medication is appropriate for the right reason and for the right person. Uh, don't discount medication, but that should probably be done through a psychologist, or I mean, excuse me, a psychiatrist or a person who has experience with medication, or a psychologist in conjunction with a primary care doctor who's experienced in this. Positive self talk, meditation, prayer, finding pleasure. And that just means finding something you enjoy. Some people sew or do woodwork, or write or play music. Um, some people veg out in front of the TV. I use that therapy every once in a while. Watch like three James Bond movies in a row or something crazy just to chill out. Deep breathing, hypnosis. There are some techniques that have to be done with a trained professional, but progressive relaxation, or it's called the Jacobson technique, guided imagery, biofeedback, acupuncture is another way. I'm one of the Navy trained providers in acupuncture, and it works for anxiety and stress. It also works for various other issues. So, stress stoppers. So there's very simple techniques that can work for you. So here's some examples. Count to 10 before you speak. That I need to do. I speak very quickly, and I think very quickly, and I act very quickly, and that leads to anxiety, especially if you say something you shouldn't have said, or you should have thought it out before you propose the solution. So that's something that I'm continuously learning. Take 3 to 5 deep breaths. Walk away from a stressful situation and say you'll handle it later. So, say there's that person who stresses you out and they're in your face and they are stressing you out at that point. I've done this several times and I say, stop, please. I'm going to walk away and we need to approach this conversation later after I've had a time to think about it. So that's important. Go for a walk. That helps a lot of us. Don't be afraid to say I'm sorry if you make a mistake. That's very important, especially for leaders. When you're dealing with people that you manage, and you caused somebody some anxiety and stress, but it was something that you could have approached in a different way, or if you're flat out wrong, just say it. Walk up to them and say, I'm really sorry. I approached that the wrong way, and I apologize, and I will try to do better in the future. Set your watch for 5 to 10 minutes ahead to avoid the stress of being late. That's something I do. That works for some of us. Break down big problems into smaller parts. Uh, for example, one letter or phone call per day instead of dealing with everything at once. I tend to deal with too many emails at a time where things don't need to be answered right away. I can wait 2 or 3 days on some of these non-urgent emails, but you have to categorize them so you don't forget about them. That's important. Drive in the slow lane or avoid busy roads to help you stay calm while driving. Um, the That actually works. Um, if you've ever driven to Vegas from LA or Southern California, try get in the slow lane or the fast lane, and just stay in the lane without changing lanes. And it's pretty hilarious. And there's studies that show this. The guy that keeps changing lanes, you'll beat him because he ends up like several cars behind you, and it's stressful to do that. So just pick a lane, stay there, and just stay there. Smell a rose, hug a loved one, or smile at your neighbor. Um, I keep thinking about the Boy Scouts. Do a good turn daily. Do something nice for somebody, just randomly. That'll help you to deal with stress also. It helps you and helps the other person. Consider meditation or prayer to break down the negative cycles. So these are just things that work for some people, and you can pick the ones that work for you. So, a summary of what we talked about today. We talked a little bit about the overview and the incidence and the significance of stress. We talked about provider burnout, and you can just substitute healthcare worker in there because all of us are who work in a healthcare setting. It does not matter what you do in that setting. There's different days and different situations that we all have stress. And we talked about drivers of that stress and mitigation of that. I briefly mentioned the Navy Operational Stress Control Program. It's important, but this lecture is not about that. But I just wanted to mention that. Work and life stress, we talked about internal stressors, physiology of stress, symptoms and diseases that were related to stress. And then we talked about briefly about the treatment of stress and performing stress stoppers. And I just want to reiterate again, for everybody in the military, this is all branches of the military. There's a crisis line, 1-800-273-TALK. Hit option 1 on there. You can text 838-255. You can visit www.militarycrisisline.net. It's confidential, it's free, and it's 24/7. So if you or anybody you know has a situation that they're dealing with, you can call that line, and there's trained professionals there who will help you. So thank you very much for allowing me to present this today, and take care.